Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Who's ever heard of regenerative medicine? Well, a lot of us have. It's new, but it's not so new because ancient history has told us that the ancients did this, but then we came up with all sorts of innovations and it wasn't as good. So now we have some really smart people who are helping. Dr. Robert Amore, who's the owner and founder of Amore Anti-Aging, and we have his patient educator, and that's Rick Pepe. So, welcome to our show, gentlemen.
Thank you. Thank you for having us.
So, if you were in an elevator and they asked you what you did and you only had 10 floors, Dr. Amore, what would you say?
I would say that I work with regenerative medicine and I help people stay young.
Well, that's pretty good. You did that faster than you'd be downright.
Yes.
And how about you, Rick?
Well, patient educator to educate people about health, about their diets, about what they should do forward, finding out how they feel, and just tell them things about what they should be doing.
Right, and of course with regenerative medicine, it's exactly what it says. You're going to regenerate them. And you're not going to use pills. You're going to do other things, right? So as a chiropractor, I know what your themes are much better than, I'm sorry, I know we have a lot of doctors on our show, but I know that you think differently.
Mm-hmm. So, we believe as chiropractors and as professionals that want to help patients today and not to hurt them so much with all the medications that they're utilizing out there. So we believe in utilizing things that will promote growth and change to the body naturally instead of something that will destroy it. So we're getting into, and we've gotten into regenerative medicine for that reason. It's become very popular. One of the big things today is people want to get away from medication. They really actually want to get better. If they have knee joint injuries or shoulder injuries, they don't want to go down that path with surgery, because that's a long-term situation. There's rehab involved, there's possible infection involved. So the big thing today now is doing regenerative medicine, which takes a simple injection and off you go home, and there's no downtime. That's a wonderful thing for a lot of people today because they want to keep moving. They're very active today. So when you bring that up to someone, they understand that, hey, this could be the way of the
Put
future.
me in.
Yes,
right?
put me in the book. So this is what's happening, and we're getting a lot of people calling us on this and saying, what's going on with this regenerative medicine? Is it safe? Is it this? Is it that? So that's
well, you show stem cell therapy. You show hormone replacement therapy. All these things now. Platelet-rich plasma, PRP, facial and hair restoration. I mean, who doesn't want all this? So how long, let's say someone comes to you and they want everything. How would you go about this?
Well, I think what we would do is take the main problem first. Because when you're dealing with stem cells go to an inflammatory area. So if you have a knee injury and you want your face done, I think the knee would probably be the priority. Though a lot of people will go past a picture seeing a nice face and they want their face done, but that's what we would consider, first working with the main areas. Okay, so any type of stem cells, they direct themselves when we inject the stem cell into a joint area or into the face or into the body. It's going to go where problems are. And that's what's the cool thing. It goes in there and it creates a new tissue format for that particular injured area. Example, if you have arthritis of the knee, which is when the smooth cartilage, which is called hyaline cartilage on the knee, has disrupted, it's broken down, it's very rough now. So when you put an injection of stem cell into that area, now that stem cell, which has no DNA and has not created a tissue of yours yet, it goes in there and finds the tissue that needs to make, and it makes that tissue for that particular area and creates brand new hyaline cartilage. Now you have a new set of tissue and a new knee. And now the pain goes away, the joint is working better, the spacing is better. this is what we're doing with stem cells today.
So, Rick, how do you sleep at night? This is pretty exciting stuff, isn't it?
It is very exciting. I mean, just getting the word out there, let people know exactly what we do. And that's basically been the hardest part.
That's why you're here.
Most
We're going to
people,
do a lot of
they,
this and get you out there.
It's all, people, want to, it's all about surgeries, taking opiates, as we know it's a huge problem in this country. So we're trying to get people away from that, trying to get people in a healthy lifestyle. That's the main thing here. Even when you do stem cells, you got to be in some sort of healthy state to even get stem cells done. Because if you're not, those stem cells are not going to work as well. So we even have another program that we're going to start doing this coming up Friday, where basically we're going to have a machine that scans for oxidative stress in the body to tell us what your antioxidant levels are in the system. And that will tell us, a certain number. If you're low, most people tend to be lower than higher. 96% of the population is in the lower antioxidant activity. They have higher oxidative stress. Oxidative stress is basically, chemicals that we breathe in, people that smoke, cars smoke, foods that we eat. They cause a lot of oxidative stress in our body. Exercise, stress, and basically what happens is it destroys some of the DNA. Antioxidants help to shield, help to protect that DNA. So this machine helps to gauge and find out what level that you're in. So on Dr. Oz, to give you an example, they did a whole show about this particular machine. It was a 10-year study that was done at Harvard. And 96% of the population had lower antioxidant activity, which makes you more prone to disease like arthritis, makes you more prone to cancer, autoimmune diseases, cardiovascular, neurological diseases. So that's another aspect that we're starting to give to the clinic so we can move them forward to doing, platelet-rich plasma, stem cells, chiropractic, getting their nutrition and getting their bodies healthy first.
Well, let's just talk about Amore Anti-Aging, the whole organization. Actually, I'm going to just give people phone numbers, and they're located in Coral Springs on North University Drive. That's 1500 North University Drive. I'm going to give you a phone number so that you can call them and make an appointment. And I'll keep giving you this number, 954-755-0224. But what we're going to do is, I think, make believe they're listening, and they say, oh, yeah, I want all of it. I'm going to come in. So who do they see? They see you first, Rick, and then you register them, or they see Dr. Amore first?
Well, they come in first. They obviously they see me first. They'll fill out paperwork. Then from the paperwork, then we give it to Dr. Anthony, where he checks everything over. And from that point, the patient comes in, and the doctor evaluates the patient.
I just learned his name, Dr. Anthony Amore.
Well, no, that's Dr. Anthony. Is another doctor.
Oh, I'm sorry. So
we
it's
have three. Yeah, we have three doctors.
Yep.
So Dr. Anthony, yes, that's right. Dr. Anthony is our doctor that does most of the injections.
I see.
And I oversee the office. And so that's the thing. So Dr. Anthony is not here today. He's in Israel, but Dr. Anthony.
No, but so there are a lot of you there that are doing different things.
A lot of specialists there that know what they're doing. So you have to have that. You have to have someone who takes the patient in, talks to them like Rick does, and gives them information. There's also the person that talks to them about finances. There's a little bit of everything. So you have to go through that. There's people that take X-rays, so we have to do that.
That was my next question. So how are you able to tell what their condition is? With X-rays and there are other tests that you run?
So we'll run the diagnostic X-rays of joints. Right, initially, and we'll see what that joint looks like under X-ray, because X-ray is a bone picture. It's not a soft tissue picture. It's bone only, hard tissue. So that's what we're looking for right now in that particular. If someone comes in for a shoulder joint, or they come in for a knee joint or a hip joint, we're looking for degradation of that joint. Okay, so we'll look at that, and then Dr. Anthony and I will speak, and we'll talk, and I'll say this, and whatever. And but what happens is when you have that situation first, and then we'll do a diagnostic ultrasound, which is a guided ultrasound. So when we're going to do an injection, we want to see where this needle's going, right? There's certain areas you need to know to stay clear of, and certain areas you can go into. But it's a real simple procedure. It's a one injection, and when we deliver those stem cells, it's it. There's no like, I have to, have rest for 10 days or anything. I mean, they just go off and do their
I have known people that have had stem cell therapy, and it's been very effective.
Yes.
It's been just exactly what you said. It's some people have actually had to go abroad to do
Yes.
it, but apparently now you're able to do it right here under safe conditions.
Mm-hmm.
And it's wonderful that
Yes.
you're doing this. And I think what I like about all this is that you offer many things.
Mm-hmm.
I know that facial and hair restoration has nothing to do with stem cells, I don't think, right?
Well, you
Oh,
can
no, right?
utilize
Okay,
some
Rick's
stem
shaking
cells.
his head.
Yes.
Yes.
You can use stem cells, but we use platelet-rich plasma as well. But facial rejuvenation is, I'm sure you might have heard of
The Dracula,
vampire
yeah.
look.
Right.
Yeah.
So facial rejuvenation, they use microneedling. Okay, it's tiny, and they inject they inject PRP. Your own. What the PRP is basically taking your own blood, spinning it down and separating the platelets and the plasma, and then re-injecting the good parts, okay, back into those areas. And that's what they do with your face or your hair, and that's how things start to grow. Now, with facial rejuvenation, they heat up the PRP and they make it kind of like a little, so they can mold it like a mayonnaise type, and they inject it in. It's like a filler now. So what do they use for fillers? Juvederm, Restylane, Botox. Those are what they use now, and they last about 3 months, right? And then you got to go back again, and they pay $200 or whatever they do every time they do a shot. So with facial rejuvenation and with the PRP, it's your own cells. It increases collagen and elastin, so it starts to, all the little lines we get as we get a little bit older, they start to dissipate because you're filling them and they're growing new tissue again. And that lasts about 18 months to 2 years. So this is a big thing for a lot of people. So we have to do that facial rejuvenation about 3 times, and we do it every 4 to 6 weeks for 3 times, and that's it.
Well, this is very exciting. So now, Rick, I know why you have this smile on your face, like you like to be the educator, because there's so much there. It's hard for somebody to grasp all this, isn't it?
It is. And to explain everybody exactly how everything works, that's the whole process. Trying to educate people, let people know this is what we have today, which you're doing, with, like he said, with the Botox, these other type of drugs. They're only temporary type of situations. You want something to be more temporary, and that's exactly what we offer, doing the stem cells to PRP. And that's the PRP is huge right now. It's very big out there, especially for, like you said, for facial, for hair regeneration, but also again for joints too. That's another option,
Well, when I listen to both of you, I'm thinking about many years ago, I knew many doctors who wanted to join this anti-aging society. And they all jumped into this because they knew that there was more than what they were doing. Medicine's one thing, and of course they were trained in a traditional way, but I think this is really the cutting edge. This is where it all is. So and I don't know your first name, Dr. Amore.
Robert.
Robert, okay, I got it now. So, Dr. Amore, how did you study to be a chiropractor? When did you get this interest to do this?
Well, I've been a chiropractor for over 32 years. But I'm always looking for things to improve patients' pain levels or health levels. I want them to get better. And there's a lot of things out there that people would get from orthopedics or other doctors, but they were temporary. And they'd come to me and they said, well, I went here, I had this done, but I still have this problem. And it would bother me a lot. Why don't they have something else out there that can really help a patient get better? There's got to be something. I mean, why do people have these diseases? Why don't they get better? Where's the cures? Where's all the money going? You start thinking about all these things. And so I got interested in this a few years back, and I said, well, let me see and check some more things out. And I started getting into it, and I looked at regenerative medicine. And it's been around for a while, regenerative medicine, a long time actually. But because of the states, they kind of keep things down. I mean, they're not going to give up $1 billion industry, the pharmaceutical companies, for allowing regenerative medicine to come in and fix things. You know, they're not going to do that. They'd rather keep you sick than healthy. That's no money in keeping you healthy. You know, it's more money keeping you sick. So
Well, and also it's quite painful.
it's great.
You know, so when you think about it, just like I know that my husband had knee surgeries, both knees. He had 4 hips, and but he did walk after that with everything, but it took quite a while, very painful surgery, and if now he could have had the the rich platelet and all that, the stem cells, it probably would have been better. But as I said, they weren't allowing it here in the United States, so this is wonderful.
They were doing a lot. Actually, there's a Dr. Neil Reardon that does it in Panama, and he also has a clinic, I think, in Arizona now. But he was on the forefront of doing stem cells, and he does everything in Panama. I mean, he does things from cancer to leukemia to Alzheimer's to you name it, everything.
Fabulous.
We have him on our website. He helped Mel Gibson's dad, who was 91 at the time, had a bad hip, and they injected stem cells. He was in a wheelchair at the time. They injected stem cells. He started feeling better. He was able to walk, so they started doing more to him, and he's 99 now. He's still doing good. He's moving around, dancing. So Mel Gibson tells a story. If you go on our website, you'll see it. And
he's had work done there
he's
himself.
had work too. Mel Gibson always had a shoulder problem.
Yep.
So a lot of these people are doing it. Before it was
Cortisone.
hush hush and go out of the country.
Right,
type of
cortisone,
thing.
exactly.
That's a big one. I want to let
Cortisone.
people know. The problem is they go to these, go to the doctor, orthopedic. It's either surgery or medications. So what most patients want, they want to get rid of pain right away.
Of course.
So cortisone is the drug of choice.
Well, epidural, is that the same
Epidural
thing?
is something else.
A little bit different.
Yeah.
But cortisone, people, yes, in some instances, it will help get rid of the pain, but unfortunately, it destroys all the tissue in the area that's where it's being injected. So it's a temporary fix, but in the long run, it's actually causing more destruction.
Cortisone was used to destroy scar tissue, but it also destroys joints. So when someone gets a shot of cortisone, it's actually destroying their joint and making that injury or that area get worse. So they used to do cortisone a lot. They've cut it back to maybe 3 shots now, but they used to do it a lot more.
It's a process.
Yeah.
Okay, I know you're not vets, but I have a question. My dog has back leg problems. I'm wondering, when I'm going to go to the vet, I'm going to ask him about
Stem cells.
Stem cells.
They do for pets.
Oh, I didn't hear this. Oh, boy, is that guy going to be in trouble.
Yeah.
They do it for
Yeah,
pets.
Sure they do. Yeah.
Yes, they do.
So I can't take him to you. No, he's sure. He said, no. I better.
The joints are the same. You take a picture, you look at it.
And he could have new stem cells may then give him the musculature that he
tone.
needs.
Well, whatever he needs in that general area, whatever he's missing. You got to remember, as not just pets, but as we get older, a lot of doctors don't want to do surgery on older people.
True.
Because it's a liability, and and the time to heal and repair takes a lot longer. So this type of therapy that we do is basically there's no downtime. That's the biggest thing. You come in, you're there for about an hour, you do you go through the process, you leave,
You walk right out.
And then when do they have to come back again?
They come back in a week later. Then we reevaluate everything, make sure everything is good. Then we keep tracking them. Pretty much we try to do like 2 to 3 times a week to call them to make sure they're doing okay.
This is pretty exciting stuff. So everybody, I know you're listening, and I know you've just gotten Boomer Times, and you look in the magazine, you'll see a beautiful advertisement, Amore Anti-Aging Regenerative Medicine. And they talk about stem cell therapy, hormone replacement therapy, platelet-rich plasma, which is now called PRP. They do facial and hair restoration. We're going to talk about that in a minute. Joint rejuvenation, physical therapy, and massage therapy. I like that. Now, I'm into massage therapy. Well, it's very important.
It's very important to take care of your body.
Yeah, definitely. So what we're going to do, if you want to request an appointment, there'll be a free consultation so that you'll know what it's all about. And something I'm going to tell you, they were voted the best regenerative medicine clinic, which is exciting because there are a lot of places that say they do these things. And you really have to look at them, look at their credentials, see their history. How long have you been around?
been around for 32 years. I've been around a long time. I mean, I've been in this business a long time. The Dr. Anthony that we have, he's been trained in injections and stem cell injections, PRP he's been trained for a while. He's exceptional. So we also have a Dr. Coleman that oversees everything, and he's our medical director. So we put everything together so that the patients are getting what they need properly. We're not cutting corners. The key for anything in our office is the patient comes first. That's the most important thing, and I want to make sure that they get better and they progress from what we do.
How young can someone be to have stem cell therapy? I mean, because we know that there are a lot of kids having problems in the sports. I mean, have you had anyone that's young to do this?
We did, actually.
Yeah, we just did it.
Usually with that, we would like to do the PRP first because they are so young, where their bodies still generate significant amount of young stem cells, where it can help heal and repair that particular area, whatever area they're having an issue with. But stem cells, I mean, what do you think? I mean, pretty much all of it.
We could do just about it, but the PRP, like Rick said, will boost their ability to heal, and so for younger people, that's good. Now, the big thing you need to know is when you're young, from age 1 to 7, is your biggest and highest production of stem cells. And this is what they've tapped into years ago, that they said that, the medical profession has mentioned that when you're that age, you can actually regenerate much better than as you get older. So you produce a lot more. So as you get older, so the big question when I get in my office is, well, why can't I take my own stem cells? And so,
what do you mean take their own?
Well, they can take their stem cells from their own body, like you've heard of bone marrow,
right?
Right. Well, what happens when you do bone marrow? You pull it out of the bone marrow, and you create what at that site? An inflammation response. So now, if you inject somewhere else, where do you think that stem cell is going to go? It's going to go back to where that main problem.
Now that's interesting.
We don't like to take from your own body. First of all, your own body doesn't have as many stem cells production as when we get the stem cells. Our stem cells come from full-term pregnancies.
I didn't even ask you that. I assumed it was coming from your own.
No, blood.
Oh, wow.
Cord blood, Wharton's jelly, cord blood, very, very nutrient-based stem cells. The highest level of stem cells is the cord blood, the Wharton's jelly.
Very high mesocamium stem
So
cells.
that's what we do, mesenchyme.
Yep.
So the thing is that that's the big key. Now, when you inject stem cells from a newborn, full-term pregnancy, the placenta and the cord they go through a whole process of cleaning and taking care of all of this before, and the FDA has to approve everything. So it's all gone through a whole big processing. But once it's safe and it's sent to me, we inject that. But that stem cell can produce millions of new stem cells plus new cells. Whereas your own cells, if we took from you might do 100. So see the difference?
Yes.
As we get older, we don't do as much. So that's why.
And the blood cord stem cells have no DNA. So there's no rejection from the body.
No rejection process at all.
It takes on your own DNA once you put it in your body.
Once the matrix forms, then your DNA forms with that, and it becomes you. So that's what's great about stem cells. Stem cells have no direction. They're neutral, like Switzerland. They're neutral. So think about that. So when they go out and they want to go, say, you want to replace bone, they'll go and replace the bone, or they want to replace heart tissue, or they want to replace kidney tissue, or they want to replace whatever tissue. That's what they're going for, and they grow that particular tissue and become yours.
Now, see, I did not understand this until I'm so glad you shared that, because I thought this was your own. These were your own stem cells.
And a lot of places are doing that.
A lot of people do that.
We do not.
Yeah.
Well, see, that
We're
was
outside
a
the
very
box.
important point that you made.
A lot of people do that. That's one of the big things, and it hasn't really worked as well. Years ago,
I can understand why, what you just said.
Right. Years ago, they were doing it. You probably have heard of. They used to inject into the knee. You heard the chicken thing.
Yes.
It's the comb of the chicken.
Yes.
That's hyaluronic acid. They used to inject that. They used to say that was stem cells, but actually it wasn't. And a lot of people didn't do too well with that. So this is the thing that we take stem cells that are newborn, full-term pregnancies, not aborted pregnancies, It has to be full term, and what they do is they watch the parents from the 9 months from beginning to end. They do all the due diligence beforehand.
This has been absolutely wonderful. So Dr. Robert Amore and Dr. Rick Pepe, I made you a doctor today, you know.
Thank
It's okay.
you.
You're welcome.
I feel
Well, you're
much better
great.
now.
Right. But, we'll have to have you back again. And I'm going to suggest maybe you even write a little bit for our magazine on some of the things you've been saying, because this is all new stuff for me. And I've been doing this for many years. Thank you for being here with us, and we'll talk to you again.
Thank you
very
for having
much.
us.
Thank
Thank
for
you.
having us.